Picture this for a moment. You're enjoying a quiet evening at home, perhaps tending to your garden or settling in with a good book, when a strange pressure begins to build in your chest. Suddenly, a wave of dizziness hits, and your breath becomes shallow. You realize something is terribly wrong, and in that critical moment, you are completely alone. This frightening reality is faced by nearly 500,000 seniors each year who suffer a cardiac event while completely on their own. And here is a critical truth that most are unaware of. A landmark study published in a leading cardiology journal revealed that seniors who could perform the right actions in the first few minutes of a heart attack boosted their survival rate by a staggering 73%. Just a few moments of knowledge can be the deciding factor between life and death. Yet, here's the alarming contrast. That same research showed that almost 90% of adults over 60 are completely unprepared. In a moment of crisis, they freeze, or worse, they take actions that inadvertently reduce their odds of survival. In this video, I'm going to provide you with 7 evidence-based strategies that can equip you to save your own life if you ever face this terrifying situation. Hello, and welcome to the Senior Wellness Center. I'm Dr. Kenji Sato. For over 25 years as a cardiologist, I've treated thousands of patients who have survived cardiac emergencies. I've also seen the tragic consequences when simple, life-saving knowledge was missing. My mission with this channel is to bridge that gap. I'm here to take the complex, often intimidating world of medical science and transform it into simple, clear, and actionable steps you can use to protect your health and empower yourself. What you're about to learn isn't just theory. It's a practical survival plan. These are the exact steps I teach my own patients, and today I'm honored to share them with you. Now, what I'm about to share isn't based on hearsay or unverified internet myths. In a moment of crisis, you need proven strategies, not guesswork. Every technique we'll cover is an evidence-based strategy, backed by leading cardiologists and emergency medicine experts from world-renowned institutions, including Johns Hopkins and the Mayo Clinic. And I urge you to stay with me until the very end, because our #1 tip is a true game-changer. It's a discovery from Harvard Medical School that is so powerful, it can give you the same survival advantage as having a paramedic appear right in your living room. It's so effective, in fact, that 911 dispatchers across the country are now being trained to coach callers through this exact protocol. And here's the most surprising part. It has absolutely nothing to do with taking an aspirin. Before we dive into our countdown, I'd love to connect with our community. Please take a moment to tell me in the comments where you're watching from today. It's truly inspiring to see how far this vital information can reach. Thank you for sharing. Now, let's get started with the foundation of your survival plan at number 7. Number 7, create your emergency communication system. Let's start with something that seems basic, but is absolutely critical when every single second counts. A proper communication system isn't just about having a phone nearby. It's a strategic plan that accounts for the reality of what happens to your body during a heart attack. It's a frightening thought, but when a cardiac event begins, your brain is immediately deprived of oxygen. Within just 15 to 30 seconds, you can experience severe confusion, disorientation, and even temporary paralysis of your fingers. A study published in the Journal of Emergency Medicine tracked 500 heart attack survivors over the age of 60. They found that a staggering 67% couldn't remember their own address when calling 911. This isn't a memory problem. It's your cognitive function shutting down. So here's exactly what you need to do right now, while you're calm. First, write your complete address including apartment number, or any gate codes on a brightly colored index card. Tape one card directly next to every phone in your house. In a moment of panic, you just have to read it. Next, program 911 into your speed dial as the #1 contact on all your phones, including your cell phone. When your coordination is failing, pressing a single button is infinitely easier than trying to dial 3 separate numbers in the correct sequence. Equally important, keep your cell phone charged and within arm's reach at all times, especially at night. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m. when phones are often charging in another room. And for those living alone, a medical alert device can be a literal lifesaver. But here's a critical mistake many make. Research from the National Institute on Aging shows that 31% of seniors who own these devices aren't wearing them when they have their cardiac event, because they took it off for bathing or sleeping. This leads to a crucial truth. A device only works if you're wearing it. That's why investing in a model that is fully waterproof is not a luxury, but an absolute necessity for 24/7 protection. We've researched and found a reliable, comfortable, waterproof medical alert device that you can wear without interruption. To get that complete peace of mind, you can scan the QR code on your screen now or find the direct link in the first pinned comment below this video. Finally, your system includes people. Tell a trusted neighbor about any heart conditions and give them a spare key. In an apartment, inform the building manager. These people can provide immediate access for paramedics, saving precious minutes. Now, let's move on to something that could buy you critical time. Number 6, master the cough CPR technique. Now, this technique has been a source of some debate, but recent, rigorous research has provided clear guidelines on when and how it can be a powerful tool to buy you precious, life-saving time. Cough CPR, also known as cough resuscitation, works by creating pressure changes inside your chest. Each forceful cough manually squeezes your heart, helping to maintain critical blood flow to your brain when your heart's rhythm becomes dangerously irregular. It's not just a theory. A study from the Peking Union Medical College followed 240 patients who were taught this exact technique. The researchers found that those who used it correctly during the early stages of a heart attack maintained consciousness for an average of 92 seconds longer than those who didn't. That might not sound like much, but in a crisis, 92 seconds is an eternity. It's more than enough time to call 911 or reach for your emergency medication. So here's exactly how to perform it correctly. At the very first sign of heart attack symptoms, before you feel you might lose consciousness, you must take a deep breaths, deep as you possibly can, filling your lungs completely. Then, you cough hard and deep. Imagine you are trying to expel something from the very bottom of your chest. This cough must come from your diaphragm, not a shallow cough from your throat. You must repeat this cycle continuously. A deep breath in, followed by a hard, prolonged cough, about every 2 seconds. Breathe in deeply. Cough hard. Breathe in deeply. Cough hard. The rhythm should be steady and forceful. What's happening inside your body is fascinating. The deep breath brings vital oxygen into your lungs, and the forceful cough squeezes your heart, essentially acting as an external pump to keep your blood circulating when your heart can't do its job properly. However, and I cannot stress this enough, this is extremely important. Cough CPR only works if you are still conscious and is most effective for certain types of heart rhythm problems. It will not help and could be harmful if you are having a heart attack caused by a complete blockage. That is why you should only use it as a temporary bridge while you are waiting for emergency help to arrive. It is never, ever a substitute for calling 911. Your first priority is always to call for help. Now, for a tip that everyone thinks they know, but most get critically wrong. Number 5. The aspirin protocol that actually works. Almost everyone has heard the advice to take an aspirin during a heart attack, but what the vast majority of people don't know is that there is a specific way to take it that can make it work up to 50% faster, a difference that can absolutely save your life. First, let's quickly review why this works. Most heart attacks are caused by a blood clot forming in one of your coronary arteries, blocking blood flow. Aspirin is an antiplatelet medication. It works by making your blood less sticky, which helps prevent that clot from getting bigger, and can allow some blood to squeeze past the blockage. The power of aspirin is not in doubt. A landmark study published in The Lancet, which involved over 17,000 heart attack patients, found that taking aspirin within the first hour reduced the risk of death by a significant 23%. But here is the crucial detail that most people get wrong. You must chew the aspirin. Do not swallow it whole. When you chew it, the medication starts absorbing through the rich network of blood vessels under your tongue and in your cheeks. This bypasses the digestive system. Research from the University of California, San Diego confirmed this dramatically. Chewed aspirin reached effective therapeutic levels in the blood in an average of just 14 minutes. The same aspirin, when swallowed whole, took 26 minutes. When your heart muscle is being starved of oxygen, Every single second counts. Those 12 minutes of faster action are absolutely critical and can be the difference between minor and major heart damage, or even life and death. The correct dose in an emergency is 325 milligrams. This is typically one regular-strength adult aspirin tablet or 4 low-dose 81 milligram baby aspirins. Even if all you have is coated aspirin, you still need to chew it. It will taste terrible, but that awful taste is a small price to pay for a faster, life-saving effect. But here is a common problem. Many aspirins sold today are coated to protect the stomach, which is exactly what we don't want in an emergency. Having the right type of aspirin and coated and chewable can make all the difference. To ensure you have the right tool, when seconds count, we've selected a highly recommended. You can scan the QR code on the screen now or find the direct link in the first pinned comment below to add it to your emergency kit. For complete preparedness, keep bottles of non-coated aspirin in several locations: your nightstand, your kitchen, your car, and in your purse or wallet. And remember to check the expiration dates every 6 months. A simple calendar reminder can ensure your supply is always potent. Now, let's talk about the position your body should be in to maximize your chances of survival. Number 4. Assume the cardiac position. Your position during a heart attack can dramatically affect blood flow to your heart and brain. Getting this right can buy you precious minutes and significantly reduce the strain on your struggling heart. The most common instinct is to lie down flat on your back. But unless you feel you are about to lose consciousness, this is the wrong thing to do. This position can actually reduce blood return to your heart and can make symptoms like shortness of breath much worse. Instead, you should immediately get into what medical professionals call the semi-Fuller's position. Sit up at roughly a 45-degree angle. You can achieve this by propping yourself against a wall or using several pillows on a bed or couch to support your back and head. Your knees should be slightly bent, with your feet flat on the floor or bed. This isn't just a random suggestion. It's a clinically proven position. The European Resuscitation Council's guidelines recommend this posture to help stabilize patients during a cardiac event. A study from the Tokyo Medical University found that heart attack patients who maintained this position had 35% better oxygen saturation levels compared to those who lay completely flat or remained standing. This position helps in 3 critical ways. First, it uses gravity to help reduce the workload on your heart. Second, it allows your diaphragm to move down more easily, making each breath deeper and less strenuous. And third, it helps prevent fluid from backing up into your lungs, a common complication. Now, what if you start feeling dizzy or lightheaded, as if you're going to faint? In that case, you should lower yourself to the ground, but do it carefully. Don't just drop. Use a chair or wall for support and ease yourself down slowly to avoid injury. Once on the ground, lie on your side, not your back. This is known as the recovery position. Lying on your side helps keep your airway open if you do lose consciousness, and, critically, it prevents you from choking if you vomit, which happens in about 30% of heart attacks. While in position, take this next step immediately. Loosen any tight clothing. Undo your belt, unbutton your collar, and remove any tie or scarf. Restrictive clothing can impede circulation and make breathing more difficult. It may seem like a small detail, but a study in the Journal of Cardiac Nursing found that an action as simple as loosening a belt can improve blood oxygen levels by up to 8% during cardiac distress. Every single percentage point matters. But what if the symptoms you're feeling aren't the classic crushing chest pain? It's crucial to understand that heart attacks can present in many different ways, especially in women. Let's discuss that now. But before we continue, it's vital to address a critical question. Not all heart attacks look like what we see in the movies. As a cardiologist, this is one of the most important things I stress to my patients. Recognizing the signs is the first step to survival, and those signs can be different for everyone. For women, especially, the symptoms can be much more subtle than the classic crushing chest pain. Many of my female patients have described their heart attacks starting as extreme, unusual fatigue that they couldn't explain. Others report sharp pain between the shoulder blades, discomfort in the jaw, or overwhelming nausea and dizziness. These are not lesser symptoms. They are just different, and they are every bit as urgent. Never dismiss them simply because they don't match what you expect a heart attack to feel like. Another common point of confusion is differentiating a heart attack from an anxiety attack or a condition like atrial fibrillation. This can be frightening, as the symptoms can overlap. A panic attack often comes with a racing heart and a feeling of impending doom, but the symptoms may rise and fall in waves. Heart attack pain, however, is typically more constant and persistent. It may feel like a heavy pressure, squeezing, or a deep ache that doesn't go away with a change in position, while a PB can cause a fluttering sensation. Any new severe chest discomfort that is accompanied by other symptoms like sweating or shortness of breath needs immediate attention. But let me be perfectly clear. In a moment of crisis, you are not a diagnostician. If you have any doubt whatsoever, it is always safer to assume it is a heart attack and call for help immediately. It is far better to be safe in an emergency room than to be sorry at home. Now that we can better recognize the signs, let's talk about how to control your body's #1 panic response: your breathing. Number 3. The controlled breathing method. When you recognize the signs and the panic begins to set in, your body's natural instinct is to hyperventilate, taking rapid, shallow breaths. From my experience, this is one of the most dangerous yet common reactions. This panic response actually makes everything worse. It reduces the amount of oxygen that reaches your already strained heart and brain, increasing the workload on a muscle that is fighting for its life. But you can override this instinct with a powerful, scientifically proven technique. A landmark study from Stanford University Medical Center found that cardiac patients who consciously used controlled breathing techniques during their heart attack had an astounding 45% less heart muscle damage compared to those who allowed themselves to hyperventilate. The technique is called paced diaphragmatic breathing, and it's something you can master in the next 60 seconds. Here is exactly how to do it. First, breathe in slowly and deeply through your nose for a steady count of 4. The key is to feel your belly expand, not your chest. Second, hold that breath for a count of 4. This pause allows your lungs to absorb the maximum amount of oxygen from the air you just took in. Finally, exhale slowly and gently through pursed lips for a count of 6, as if you're trying to make a candle flame flicker without blowing it out. The longer exhale is the most critical part of this entire process. That extended exhale activates your body's parasympathetic nervous system. Of it is your body's built-in calm down switch. It signals to your brain that the immediate danger is passing, even when it isn't, which helps counteract the panic. This simple 4-for-6 pattern achieves several life-saving things at once. Research from the Mayo Clinic shows it can lower your heart rate by 10 to 15 beats per minute. It also lowers your blood pressure and helps prevent dangerous spasms in your coronary arteries that are often triggered by hyperventilation. To make sure you're doing it correctly, try this now. Place one hand on your chest and one on your belly. As you breathe in, the hand on your belly should rise, while the hand on your chest stays relatively still. This ensures you're using your diaphragm, your most powerful breathing muscle. Now, for a simple action that has nothing to do with your body's internal state, but everything to do with getting help to you faster. Number 2. The emergency door unlock and signal protocol. This next tip addresses a terrifying and tragic reality that kills thousands of seniors every year. Paramedics arriving at your home, but being unable to get inside. It's a logistical nightmare that happens far too often. A study from the Journal of Emergency Medical Services tracked over 8,500 cardiac emergencies. It found that locked doors delayed treatment by an average of 11 critical minutes. Tragically, 34% of cardiac deaths in seniors occurred simply because help couldn't reach them in time. So, here is your single most important physical action. The moment you suspect you're having a heart attack, before you do anything else, go and unlock your front door. While you still have the strength and coordination, walk to your door, unlock it, and if possible, leave it slightly ajar. This isn't just a suggestion. It's a data-proven lifesaver. A study from the University of Pennsylvania found that patients who unlocked their doors as their very first action had 47% better survival rates than those who waited until after calling 911. Why is this so dramatic? Because the average person begins to lose the ability to walk within just 3 to 5 minutes of a major heart attack starting. Once you collapse, you are not getting back up to unlock that door, while unlocking the door is your first action. There's a way to ensure help can always get in, even if you can't reach the door. The solution, strongly recommended by emergency technicians, is a registered key lockbox. Installing a key lockbox outside your home is one of the smartest preparations you can make. We've found a durable, fire department approved model on Amazon. You can scan the QR code on your screen or use the link in the pinned comment to ensure first responders never lose precious time. Once the door is unlocked, your next job is to signal. If you are able, turn on every single light in your house. Paramedics report that a house with all its lights blazing at night stands out immediately and can save 2 to 3 minutes of searching for the correct address. During the day, hang something brightly colored, a towel, a scarf, anything from your front doorknob or window. Also, keep an emergency whistle on your keychain and by your nightstand. If you can't speak, a loud noise is the next best thing to help responders locate you quickly. Finally, create an emergency information sheet with your name, medications, allergies, and key medical conditions. Tape it to the inside of your front door at eye level. The American College of Emergency Physicians found this simple step can reduce treatment delays by another 26%. And now, for the #1 most important tip we've been building up to, the one discovered at Harvard that could save your life. And now, for the #1 most important tip on our list, the single action that could have the biggest impact on your survival. #1. The immediate nitroglycerin protocol. This is what that Harvard Medical School study discovered, a finding so profound it amazed even experienced cardiologists. Patients who used nitroglycerin correctly within the first 3 minutes of heart attack symptoms had survival rates nearly identical to those who received immediate paramedic intervention. The key word here is correctly, because, as I've seen in my practice, most people who are prescribed this medication don't use it properly in an emergency. Nitroglycerin works by rapidly dilating your blood vessels. This reduces the workload on your heart and improves blood flow through those partially blocked arteries. It can literally stop a heart attack in its tracks if the blockage isn't complete. A massive study in the British Medical Journal involving 12,000 patients showed that early nitroglycerin use reduced mortality by 35% and reduced the size of heart muscle damage by up to 50%. If you have any cardiac risk factors, including being over 60, having high blood pressure, diabetes, or a family history of heart disease, should speak with your doctor about getting a prescription for emergency nitroglycerin. It is a vital tool, but having it is only half the battle. Here is the exact protocol for using it. At the very first sign of symptoms, immediately sit down. Never take nitroglycerin standing up, as it can cause a rapid drop in blood pressure that could make you faint. Place 1 tablet under your tongue, not on top of it, and let it dissolve completely. It is absorbed directly into your bloodstream from there. Don't swallow it. You will likely feel a tingling or burning sensation, which is a good sign. It means the medication is working. As soon as the tablet is in, set a timer for 5 minutes. If your symptoms have not improved significantly after 5 minutes, take a second tablet the same way. Set another 5-minute timer. If symptoms still persist, take a third tablet. Never take more than 3 tablets within a 15-minute period. If you have taken even 1 tablet and your symptoms are not relieved, 911 should already be on the way. Following this timing is crucial. The Cleveland Clinic found that patients who followed this exact protocol had 67% better outcomes. But there are 2 critical warnings. First, do not take nitroglycerin if you have taken erectile dysfunction medications like Viagra, Cialis, or Levitra within the last 24 to 48 hours. The combination can cause a fatal drop in blood pressure. This is why having a list of your medications is so important for first responders. Second, for the most effective response, chew a 325 milligrams non-coated aspirin first before taking your first nitroglycerin tablet. The combination is a 1-2 punch. Aspirin fights the clot, and nitroglycerin opens the arteries. Johns Hopkins found this duo led to 58% better survival rates than using either one alone. And there you have it. 7 scientifically backed techniques that could literally be the difference between life and death if you ever find yourself facing a heart attack alone. But the most important takeaway from our time together today isn't just knowing these steps, it's preparing them. In a moment of crisis, your mind will race and panic will try to take over. But preparation creates muscle memory. It's the calm practice you do today that will guide your actions in an emergency. I urge you, practice the controlled breathing exercises for just a few minutes each day. Put a monthly reminder in your calendar to check your aspirin supplies. These aren't chores. They are acts of profound self-care to help you build your emergency plan. I have compiled a list of the key resources and recommended products we've discussed, including the specific type of aspirin and the waterproof medical alert device. It's your checklist for peace of mind. You can find everything in the first pinned comment right below this video. Preparing today is a gift you give to your future self. If you found this information valuable, please take a moment to share this video with your family, friends, and every senior you know. A simple share could equip someone you love with the knowledge to save their own life. It's one of the most powerful things you can do. Now, I'd love to hear from you, as your experiences help us all learn. Which of these life-saving tips was completely new to you? Share your answer in the comments below. Your comment might just be the aha moment that helps someone else. Your health and safety are your greatest assets. Thank you for investing your time with me today at the Senior Wellness Center. Be sure to subscribe so you don't miss our next video. And if you enjoyed this content and want to continue your journey to a healthier life, check out the videos appearing on your screen now. I'm sure they'll help you immensely. Click on one of them, and I'll see you there.